Hello everyone, I hope you are doing great. So today we are going to discuss about the cubital fossa. So cubital fossa, before discussing about it, we are going to discuss this under the following headings, which includes the boundaries, then the content, and lastly clinical anatomy related to it. So what is cubital fossa? Cubital fossa is a triangular area which is located in front of the elbow joint, and this cubital fossa, which is located in front of the elbow joint in the arm, it corresponds to the popliteal fossa, which is located just behind the knee joint. As we said, it's a triangular area, so it's having base, apex, and two sides. So talking about the boundaries of the cubital fossa, the base, the elbow joint is formed by the upper part is formed by the humerus, and lower part is formed by the radius laterally. So if we are taking it as a lateral side, this is as a medial side. Medial side is formed by the ulnar bone, and lateral side is formed by the radial bone. So the elbow joint is formed by the combination of the three bones, which is humerus at the upper part, and laterally radial bone, and medially ulnar bone. So the lower part of the humerus, it consists of the lateral and medial epicondyle. When an imaginary line is connected between the lateral and the medial epicondyle, then it forms the base of the cubital fossa. And as for the sides, the lateral side is formed by the medial border of brachioradialis muscle, and the lateral and the medial side of this cubital fossa is formed by the lateral border of pronator teres. And for apex, it's formed by the meeting point of brachioradialis and pronator teres muscle. These are the boundaries of the cubital fossa. And as for the roof and the floor, the roof is formed by from outside to inside. If you go from outside, so it's the cubital fossa. This is the medial epicondyle. When we connect, it forms the base, and pronator teres goes in this way, and radialis muscle it goes in this way, and it forms the triangular shallow depression, which is the cubital fossa, which is located in our arm. And in a specimen also we can see this is the humerus bone. So this is the lower part of the humerus, which shows the epicondyle. So this is of the left arm of the humerus. So this is the medial epicondyle, and these are the lateral epicondyle. And if we connect between these two epicondyles, then the imaginary line, then it forms the base of the cubital fossa. So the roof is from outside to inside is formed by the skin, then by the superficial fascia. Superficial fascia, it contains two important structures, that is nerve and vein. Nerve, these are also two in number, which is lateral cutaneous nerve of forearm, and medial cutaneous nerve of forearm. And vein, to the lateral side there is a presence of the cephalic vein, and to the medial side there is a basilic vein. Cephalic and basilic vein. Then we have deep fascia and bicipital aponeurosis. From outside to inside. And another important thing to be noted is in the lateral side there is a presence of cephalic vein, and the medial side there is presence of the basilic vein, and these two veins are connected to each other at the elbow of the median cubital vein. This is the median cubital vein, and these veins are located within the superficial fascia. This is the roof and floor is formed by the two muscles, which are supinator muscle and brachialis muscle. So now going towards the content. We can remember the content of the cubital fossa by using a mnemonic, that is N-men. N means nerve, M means muscle, A means artery, and N also means nerve. So on the lateral side, from lateral to medial, it's lateral to medial. Laterally, there's the presence of the radial nerve, because the bone which is present in the lateral side is a radial bone, so the name radial nerve. And muscle is the tendon of biceps brachii. And for artery, the brachial artery, it terminates within the cubital fossa, giving rise to the radial ulnar artery. So termination of brachial artery. And N means median nerve. Median nerve. So these are the contents. And as for the clinical anatomy, as we have already said, this is the median cubital vein. So from the medial cubital vein, we can use this vein to take some blood, which can be used for the various investigation. And the brachial artery, it is used for the measuring the blood pressure. So this is all about the cubital fossa. Thank you very much.